The Senate will come back to order. The Senate will come back to order. Will the Secretary read Senate Bill 118?
Senate Bill 118 by Senator Unterman of 45th and others, a bill will be titled and act amendment Article 1 of Chapter 24, Title 33 of the OCGA, relating to insurance generally, so as to modernize the Georgia Telemedicine Act, to rename the Telemedicine Act the Telehealth Act, to revise the definition of telemedicine, to provide a definition of telehealth, to prohibit insurers from requiring insureds to use telemedicine and for other purposes. Mr. President, that concludes the order.
Chair would like to recognize the senator from the 45th to speak to Senate Bill 118.
Thank you, Mr. President, members of the Senate. Hope everyone comes back and had a nice lunch. And we had a great press conference about human trafficking with the governor just a few minutes ago. So with that, I'd like to present Senate Bill 118, and this renames the Georgia Telemedicine Act as the Georgia Telehealth Act. It defines telehealth and redefines telemedicine. I will never forget being down in South Georgia, deep South Georgia, down below Columbus, in Clay County and Randolph County a couple of years ago, and I was in a public health building, and it was a cinder block building, maybe 20 by 60, just a small building on a small lot, but it was the only access to care in that particular county. And I asked the public health nurse, I said, well, where are the professionals in this county? Where are the doctors? Where are the nurses? And she pointed next door, and she said, Senator, that's the jail right there. We got a sheriff right next door. And I was just kind of flabbergasted coming from a suburban area with so much access to wonderful health care. So I asked her when we went in the building, there was a broom closet, and there was a machine in the broom closet. And I said, what is that in there? And I knew exactly what it was. It was a machine that sends telemedicine when you're examining a patient to send it somewhere else. And I said, well, what's it doing in there? Well, we don't use it. And that's exactly what this bill does and aims to cure. Because right now, when a provider sends the telemedicine, whether they're looking down your ear with an otoscope or they're listening to your heart, then it sends it to the person that reads it. And unfortunately, when we created the original Telemedicine Act, it was a one-way system and there wasn't parity. And as we all know, people aren't going to work for free. It's a two-way system, and it has to have a reimbursement stream to it. And that's exactly what this bill aims to work out in Senate Bill 118. It provides for reimbursement to distant and originating sites. So that person that was in Clay County would get reimbursed for it and hopefully take the machine out of the broom closet. The good thing is, since that time, Facebook, Skype, and messaging has improved so that you literally could do this almost with a cell phone. Now, these are professionals, and we know that it would be a higher imaging than that. But fortunately, it has improved. This requires health benefit plans to provide coverage for telemedicine and telehealth services. That's the main clue that it does, and that's why healthcare infrastructure will be improved. So with that, Mr. President, I'll answer any questions on Senate Bill 118. If there's not any questions, I will yield the well.
You have no questions, Senator.
Thank you. I yield the well, and I ask for favorable consideration of Senate Bill 118.
Do any other senators wish to speak for or against the bill? The chair hears none, and the previous question is ordered. Is there objection to agreeing to the report of the committee which is favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall the main question be now put? Are there any objections? The chair hears none, and the main question is ordered. Shall this bill now pass? The question is on the passage of the bill. All those in favor of the bill will vote yea, opposed nay, and the secretary will unlock the machine. On the passage of the bill, the yeas are 50, the nays are 0. This bill, having received the requisite constitutional majority, is therefore passed. Chair would like to take a moment to recognize Secretary Price, former majority leader of this great body. Thank you for joining us. For what purpose does the senator from the 33rd rise?
President, I ask unanimous consent that the rules be suspended to allow that Senate Bill 31 be withdrawn from Special Judiciary Committee and be committed to the Public Safety Committee.
Will the Secretary read the bill?
Senate Bill 31 by Senator Redd of the 33rd and others, a bill to be titled enactment Chapter 1 and Title 35 of the OCGA, relating to general provisions regarding law enforcement officers and agencies, so as to clarify that law enforcement officers should not be liable at law for any action or actions done while performing any duty at the scene of an emergency under certain circumstances and for other purposes.
Have both chairmen spoken?
Yes, Mr. President, they're in agreement.
The senator from the 33rd has asked for unanimous consent that the rules be suspended to allow Senate Bill 31 to be withdrawn from the Special Judiciary Committee and be committed to the Committee on Public Safety. Is there objection? Hearing none, the motion passes. For what purpose does the senator from the 33rd rise?
I move, Mr. President, that Senate Bill 31 be withdrawn from the Committee on Special Judiciary and be committed to the Committee on Public Safety.
Is there objection? Hearing none, the motion passes. Mr. Secretary, will you read Senate Bill 106?
Senate Bill 106 by Senator Tillery of the 19th and others, a bill to be titled enactment Article 7 of Chapter 4 of Title 49 and Title 33 of the OCGA, relating to medical assistance and insurance, respectively, so as to authorize the Department of Community Health to submit a Section 1115 waiver request to the United States Department of Health and Human Services Centers for Medicare and Medicaid Services to authorize the governor to submit a Section 1332 innovation waiver proposed to the United States Secretaries of Health and Human Services and the Treasury and for other purposes. Mr. President, that concludes the order.
Chair recognizes the senator from the 19th District to speak to Senate Bill 106.
Mr. President, I rise to a point of order.
Recognize the senator from the 6th.
Mr. President, Senate Bill 106 will have a significant impact on state revenue. I don't believe the sponsor of the bill has requested a fiscal note. I don't believe the chairman of the committee requested a fiscal note, and I do not believe that the committee voted to waive any of the requirements of OCGA 28-5-42. Furthermore, a fiscal note, at least not on my desk, is not provided with the bill to the members of this body or with SB 106. Therefore, it cannot be considered by this body or the House of Representatives pursuant to statute.
It is the ruling of the chair that this bill does not have significant fiscal impact. 3.1.4 allows us to take that provision. This only generates a waiver, and the cost of this waiver, the process of this waiver, has been addressed in this year's fiscal year supplemental budget. Thank you. Senator can take the well to address the measure.
Thank you, Mr. President. Members of the Senate, I rise to present to you Senate Bill 106. Senate Bill 106 is a very simple 3-page bill that can do miraculous things for health care and health care costs across the state of Georgia. As you may know, many in this room agree that the Medicaid system is broken. It was started in 1965. There have been no changes to that code. And if you want to do something different than the federal partnership that states have with the federal government for the Medicaid program, you have to ask permission to do something different than the 1965 Act. That permission comes in the form of what we call a waiver. What this bill does, Senate Bill 106, is allows the governor of the state of Georgia to apply for 2 waivers. One, an 1115 waiver, waiving Section 1115 of the Medicaid Act, so that we can begin to reform what many in this room believe is already a broken system. The second part of this bill allows the governor to apply for a waiver for what we would call Section 1332 of the Affordable Care Act, so that we can begin to reduce the cost of health care insurance for all Georgians, not just those below the poverty line, and not just those above. This bill is very simple in its concept, but very far-reaching in what it actually accomplishes. You see, back in my district, in your districts as well, you're probably hearing comments from people who you went to school with, who you work with on a daily basis, who you see in charities and churches across the state, who are having a hard time paying their health care insurance bills. Some are paying 2 and 3 times that health care insurance bill, or their home mortgage for that health care insurance bill. And that's not sustainable. It's not sustainable for them. It's not sustainable for us as a state. This bill doesn't just address the rich. It doesn't just address the poor. It covers the gambit of Georgians, affecting those below 100% of the poverty line by allowing them an option and eligibility to possibly apply for the Medicaid program with certain restrictions, saying, hey, listen, if you care about your health, if you're willing to do some things, the state of Georgia is willing to partner with you. And then it addresses those who are above 100% of the poverty line by saying, hey, we realize you're paying out of your pocket for health care costs that aren't sustainable over time. And we've got to get that monthly premium down so you can afford to move your family on and put monies that you are right now putting towards health care insurance, towards home payments, towards car payments, towards saving money for college, towards saving for a rainy day. The bill's very simple in its concept, very far-reaching in its scope. I appreciate the members of this body who have given me advice and comments. I appreciate those of you who have already voiced your support, and I appreciate the debate that I'm sure we will soon receive here. Thank you, Mr. President. If there are no questions, I'll yield the well.
You have questions. Chair would like to recognize the senator from the 17th.
Thank you, Mr. President. Senator Yield.
Yes, sir.
Senator, isn't it true that my mom has a pre-existing condition and the only income my parents have is what my dad makes, self-employed as a farmer?
If the senator so states, I believe it's so.
Do you further yield?
Yes, sir.
Isn't it true that every month my parents spend more on health insurance than I do on a mortgage?
If the senator so states, and Senator, they would not be alone in that category. We're hearing this from Georgians across the state.
Do you further yield?
Yes, sir.
Isn't it true that despite the fact they pay so much every month for health insurance, they have the deductible of $5,000? Everything's out of pocket up until they meet that amount.
That's a comment that we're hearing a lot as well.
One last question.
Yes, sir.
How will the 1332 waivers in particular help folks like my parents?
Thank you, Senator. The 1332 waiver allows us to apply for innovative approaches to folks who are making 100% or more of the poverty line to address the specific issue of private health care insurance premium cost. It allows us to consider innovative procedures such as high-risk pools and other items that allow us to pull out those that are costing us the most insure them differently through an invisible program that they don't really see. They don't see that as different. But it allows us to reduce the cost and push more competitors into the market for the individual marketplace. That competition will drive down costs. It's a concept we've seen across this country many times. Thank you, Mr. President. If there are no more questions, I'll yield the well.
Chair recognizes the senator from the 6th.
Will the senator yield?
I'll always yield to the chairwoman from the 6th.
So I'm interested in this pre-existing condition concept, because right now under the ACA, pre-existing exclusion prohibitions are outlawed. Is that correct?
The Affordable Care Act right now, Obamacare, does say that you have to include pre-existing conditions. Yes, ma'am.
Now, with respect to the 1332 waivers that you're talking about, and you kind of conflated the issue at first. You started and you said, well, Medicaid is a broken system and we're going to fix it. But really, the first part of the bill in terms of the, is it 1115 waiver? Correct? It's an expansion of Medicaid, right?
The 1115 waiver allows for folks below 100% of the poverty line to potentially be eligible for Medicaid. Yes, ma'am.
Right. So we're not talking about a reformation of Medicaid. We're talking about an expansion, correct? Even if it's partial under the 1115.
Whoa. No, expansion of Medicaid, as defined by Obamacare and the Affordable Care Act, actually takes it from 100 to 138% of the poverty line. So if we're going to use the definition of President Obama, no, ma'am, it's not an expansion.
Well, and that leads me to exactly my point, which is in order to get to the 90-10 match, it actually has to be an expansion, correct?
No.
And it has to be at 138% of the poverty line.
No, Senator, that is not correct.
And what do you cite to that, Senator?
Well, I will yield for your question, but here's what I'd cite to for that. I'd say that if we have 30-something other states that have already applied for waivers, those waivers have been granted for other things. If we wanted to simply expand Obamacare, we wouldn't have to apply for a waiver. The waiver process in and of itself is what sets up why we are not moving to 138% of poverty, of the federal poverty line.
Will the senator yield?
Yes, ma'am.
Has CMS ever granted a waiver with respect to 100% of the poverty line or lower thus far?
There are certain ones pending even now, but the fact that some state has not already done it is not a reason for Georgia not to try.
Senator, has a state been able to get a waiver approved by CMS for anything less than 138% of the federal poverty line?
Senator, yes. That's the entire point of the waivers to begin with. All the waivers are set on different things. They're not all tied to 138% of the poverty line. You've had...
Would the senator yield?
Yes, ma'am.
Has CMS granted a waiver of anything less than 138% with respect to the expansion part of this? We're not talking about innovation, but with respect to the expansion part of this, has they granted a waiver to any state in the union thus far with respect to that?
And then I want to carry you back to the definition of expansion to begin with. If you're going to 138% of the poverty line, you don't have to apply for a waiver.
Exactly. Has CMS granted anyone a waiver with respect to anything less than 138%? It's just yes or no. Any state.
There are some pending even now, but again, I carry you back to the statement that I just made that you're asking me the same question, and I don't mind yielding, but we need to ask a different question, though. Just because a state has not been approved does not mean that Georgia should not try. It does not mean that Georgia shouldn't try to be as efficient as it can with its money and efficient as it can be applying Georgia solutions to Georgia problems.
Would the senator yield?
Yes, ma'am.
Isn't it true that partial expansion, what this bill puts forth, would cover approximately 240,000 Georgians under the Medicaid program?
Senator, you can't speak as to that number yet because the waiver has to be applied for to begin with. All this bill does is allows the governor to meet with experts and consultants and to apply for a waiver to Medicaid. We don't know if it will cover one person or if it will cover 100 people or if it will cover 100 million people.
Senator, will the senator yield?
Yes, ma'am.
I feel like you're not answering my questions.
I feel like you're asking me the same question over and over again.
And I am. With respect to partial expansion of Medicaid at 100% or below, right? No matter what the governor ends up doing, would you agree that if there was partial expansion, 240,000 Georgians would get coverage under the Medicaid program?
If you're asking the question, and Senator, I don't want to put words in your mouth as to what question you're trying to ask. If you're trying to ask me, though, if 240,000 people live below the poverty line in Georgia, I do not have that statistic. I cannot answer that question. But you cannot say that all 240,000 people would be covered by a waiver when we're actually applying for that waiver to begin with. We don't know if those people would meet work requirements that might be included. We don't know if people are going to be wanting to go visit their primary care physician as it might be included. We don't know that people are going to buy into a process that says they have to have copays. We don't know that. So to say we know the exact number of citizens that would be covered in this process, that's an early answer.
And so with respect to that, will the senator yield?
Yes, ma'am.
So we basically don't know what this bill does as we stand here, even though we've all said it's the most significant piece of legislation that's going to be passed out of this body. Is that what I'm hearing from you?
No, Senator, that is not what you're hearing at all, but you can phrase it any way you'd like to, and there's going to be plenty of cameras to hear you do it afterwards. What this allows us to do is it allows the governor to apply for a waiver on behalf of Georgians to try to reduce the cost of health care insurance for those who would be eligible for 1332 programs, and even those who are not eligible for 1332 programs on private insurance, and it allows us to reform 1115 programs. That's what it does.
Will the senator yield?
Senator, I'll yield for one more question.
In terms of the 1332 waiver, with respect to that actually would allow for short-term health insurance policies to be sold in this state that actually don't prohibit pre-existing condition exclusions. Isn't that correct?
I'm certain that the senator would not make an incorrect statement.
Thank you.
Senator, you have several other questions. Do you yield?
Yes, sir.
Chair recognizes the senator from the 28th.
Thank you, Mr. President. Does the senator yield?
Yes, sir.
Senator, is it not true that I like cameras too?
I'm sure it is.
Will you further yield?
Yes.
Senator, in my study of health care throughout Georgia over the past several years, we've found that our rural areas are really struggling with high indigent numbers. Could you briefly explain how this is going to help our rural hospitals and our rural areas?
Yeah, thank you, Senator. Well, it actually goes back, I think the senator from the 26th spoke about this earlier. Right now, those hospitals are having to cover indigent care on their own. They're eating those costs. But what this will potentially allow them to do is they will be able to receive some pennies. Now, it might be dimes on a dollar, but the dime is better than zero, and I appreciate the senator from the 26th for bringing that up earlier.
Chair recognizes the senator from the 45th.
Will the senator yield?
Yes, ma'am.
Senator, is it not true that those of us who have served on the Health and Human Services Committee, that we know exactly, as you know, what we are working on in this bill, and we have anticipated this bill? We know exactly what's in this bill. Is that not true?
I think the words are very, very clear.
Would you further yield?
Yes, ma'am.
Senator, is it not true that the Center for Medicaid Services, CMS, there's a lot of acronyms being used today, that they issued a letter to every governor in the United States, and that letter said that they want flexibility, that they want states to think out of the box and to create and innovate new waivers? Is that not true?
Yes, ma'am. The federal government has been very clear that they want to see an incubator program that's something different, that makes healthcare work for that region, that could potentially be replicated across the country.
And would you further yield?
Yes, ma'am.
Is it not true that we have a new governor, and that's exactly what he's doing? He has checked into Washington, D.C. He has looked at this waiver program, and this is a very diligent, well-thought-out program and a well-thought-out bill. Is that not true?
Thank you, Senator. I appreciate your kind comments.
Chair recognizes the senator from the 18th.
Does the senator yield?
Yes, sir.
Senator, there's been a lot of questions from the senator from the 6th about what's going on in other states and waivers that have been passed. Could you speak a little bit to that issue of waivers that have been passed in other states and the experiences that they've had?
Yeah, thank you for that opportunity. We know that that many states have already passed waiver programs. We know that the state of Maryland passed one and saw a 10% reduction in healthcare insurance costs. Alaska saw a 26% reduction the first year, a 6.5% reduction in the second year. Minnesota, 11. They also had a second year of 27.7% decreases. These are big numbers, and they're numbers that matter to the people back home in our districts here in Georgia.
Does the senator yield?
Yes, sir.
Senator, I could not agree more with you about what our folks back home are concerned about, the examples we've heard from other senators and the personal comments you've made. Do I understand that the heart of this is to allow our governor, with the input of this legislature, to come up with the Georgia way of having waivers? Can you speak to that, please?
Yes, sir. I think you've done a very good job of speaking about it already. We realize that one size does not fit all in healthcare, and we can't just expand the federal model that's, I believe, and many of you in this room believe, is already broken. What this allows us to do is it allows our governor to apply for a waiver, to apply Georgia solutions to Georgia problems for hardworking Georgians, and I appreciate you highlighting that, Mr. Chair.
One more question, Senator, if
Yes,
you would
sir.
yield. And what you just described in the heart of this bill and what we're trying to do is have the Georgia way, but being done in a financially responsible way for our whole state. Is that true?
Yes, sir.
Thank you, Senator.
Thank you.
Senator, you have several more questions. Do you continue to yield?
I'll yield as long as the senators wish to ask questions, Mr. President.
Chair recognizes the senator from the 39th.
Senator, will you yield?
Yes, ma'am.
I think I heard you say that this bill, I was not on the Health and Human Services Committee, so I'm not as familiar as others, but the 1332 waiver in this bill allows for people at or below 100% of the poverty level to get coverage under this. Is that what I heard?
No, ma'am, you heard that wrong.
1150, say that again?
You heard that wrong.
Okay, can you explain?
Yes, ma'am. The 1115 waiver applies to folks below 100% of the federal poverty line. The 1332 waiver would apply to folks above 100% of the poverty line.
And what income is that at 100%
Yeah.
of the poverty line?
Yeah, thank you. It's going to be 100% of the federal poverty line right now in Georgia is $12,140, and a family of four is $25,000.
So for a single person making $12,140,
Yes, ma'am.
that is the income cap. So can you help me to understand how someone that might be making $12,200, a single person, how that is too wealthy to receive additional assistance through the Medicaid waiver that you're proposing in this bill?
Well, first of all, thank you so much for the question. And if I explained it wrong and that's part of your confusion, I apologize. It actually does not cap them out. There is no cap at that. What this bill allows, is that someone can possibly be eligible for Medicaid at below that $12,140. What we then pick up with is what the Affordable Care Act already has, which is subsidies at 100% of the federal poverty line and above. Those are graduated. So as you make less, you earn more in potential subsidy. So this doesn't, to say that this has a cliff or a fall off would be completely inaccurate. It's actually incredibly well suited, and I appreciate you highlighting that to folks below the poverty line and then giving a hand up, not a hand out, to folks above the poverty line to help them be encouraged to be a part of the private insurance market.
So a private insurance market that someone making $12,200 should be able to afford on a single person income, is that what you're saying? They should be able to afford to buy into the private market and they shouldn't need any Medicaid coverage because they're making over $12,140?
Well, Senator, they do have a subsidy. That was passed by President Obama in the Affordable Care Act. And if you have a problem with that subsidy, we're not in Congress and can't affect that.
Thank you.
Yes, ma'am.
Chair recognizes the senator from the 29th.
Thank you, Mr. President. Does the senator yield?
Yes, sir.
Senator, is it not true that we are currently working with medical waivers of other sorts here in the state of Georgia?
Yes, sir, we are. We actually have 5 currently already. We're in the process I'm sorry, I didn't mean to cut you off if you had another question.
Do you further yield?
Yes, sir.
What are these waivers that are currently being used for?
Most of them are being used for pregnant women. Actually, we've got an 1115 that's currently pending again to renew it's called the Planning for Healthy Babies. It covers women with low birth rate babies. We know that those cost us a lot on the back end of low birth rate babies in the intensive care that they require. So we try to put some money towards the front end of that so that that baby will not be at a low birth rate, so it costs us less at the end. That's exactly what we're trying to do here with an 1115 waiver now.
Thank you, Senator.
Thank you. Mr. President, if there are no more questions, I'll yield the
You
floor.
have several more questions. Do you yield?
Yes, sir.
Chair recognizes the senator from the 40th.
Thank you. Does the senator yield?
Yes, ma'am.
You've referred to Medicaid as a broken system. Does it not make sense that if you want to find out if Medicaid is broken, that you would ask the actual recipients of the Medicaid program?
I don't think that that's a horrible idea. That's not a bad premise.
So isn't it true that the Harvard School of Public Health surveyed 60,000 Medicaid recipients and found that they were overwhelmingly satisfied with their coverage and their access to health care?
If the senator so speaks, I'm sure she wouldn't be untruthful.
Thank you.
Yes, ma'am. Can I answer the other part of that as well, though, Senator? When you're dealing with Medicaid, you're not only dealing with people who are receiving benefits, you're dealing with providers who will tell you they're getting paid 20 cents on the dollar for what they're doing. You're also having providers who, in my area, are saying, you know what, forget it. It isn't worth me taking Medicaid. It's not worth my cost. So what we're seeing in those areas of the people who do have the ability to have care, they may be happy with it, but what about those folks where the access is closed? So what we'll do, if we talk about a budget question later on, the budget question will soon come when we will have to then be asked, if we were to go to an Obamacare expansion, we'd be asked then, well, what dollars are we going to put in this market to take that 20% payment to an 80% payment to a 100% payment? I think that's something that this body's already addressed and our governor's spoken on.
Will the senator further yield?
I'll yield for another question.
Isn't it true that customer satisfaction with the Indiana Medicaid program, one of the things they're so satisfied with is their access to providers because their regional network of Medicaid providers is so strong?
If the senator so speaks, I'm sure she is speaking correctly. I'll also tell you, though, that Indiana has come back and asked for an additional waiver because their costs are too high. But thank you for pointing that out.
Chair recognizes the senator from the 32nd.
Will Senator yield?
Yes, ma'am.
Senator, isn't it true that many providers in Georgia don't accept Medicaid currently due to poor reimbursement and a heavy compliance burden?
Yes, ma'am. The senator knows of what she speaks.
And Senator, would you yield for one more question?
Yes, ma'am.
Isn't it also true that a 1332 waiver would allow people from 100 to 138% of the federal poverty level to buy private insurance on the exchanges with a subsidy, and in fact that people from 100 to 400% of the federal poverty level would be eligible for a subsidy for private insurance?
That is absolutely correct, and a fact that I think has been glossed over by others in this body. Thank you.
Thank you.
Mr.
Chair
President.
recognizes the senator from the 36th.
Thank you, Mr. President. The senator yield.
I will always yield to my friend from Decatur.
We're so glad you joined us in this great body.
I appreciate the wisdom that you have brought to the row in front of you.
Yeah, is that enough love? But no, to the gentleman, to the senator in the well, who I greatly respect and consider a good friend.
I'll remember that after this question.
You, I believe, responded to a question related to 6, or one of the questions that was given to you, saying that you didn't know how many people would be covered if we expanded Medicaid to 138%.
That wasn't her question, Senator.
Did you not? Did she not ask you if 250,000 Georgians approximately would be covered if we went with just up to 100%, and that how many more would we cover up to 138%?
I think her question was how much would be to 100%, Senator.
Right.
I would.
We can start fresh. We don't have to
fine.
try to go back and rephrase that question.
Yes, ma'am. Whichever question you'd like to ask, I certainly
Yeah,
don't
well,
mind answering.
the fact of the matter is that studies by health statisticians at Georgia State have been telling us for ever since the Affordable Care Act was enacted, how many people we were failing to cover in Georgia as a result of not expanding Medicaid. It is a known fact. and it hovers around 500,000 people, give or take a few. Are you aware of that statistic? And that covering that many people, which Georgia's failed to do, Georgia declined the opportunity to be a part of expanding Medicaid and left federal money on the table, isn't it true, when they were reimbursing at 100% for the first 3 years. We would have had an opportunity to be bringing that federal dollars into our health system here in Georgia, isn't it true, had we done it then?
Senator, I think I got 4 questions in that, but I don't mind trying to answer all the isn't it truths. What my response would be to that is that while you say Georgia left money on the table, that was not free money. That's money being paid for by all Georgians and others. It's
which went to other states. Excuse me for interrupting.
No, you're fine. You've earned that right. You've been here a lot longer than I have. If you've got another question, I don't mind.
The point I'm making and calling to your attention and asking if you're familiar with these documents, the studies of Georgians, Georgia academics, very skilled in these matters, have consistently said it could be it's a 500,000 people or more that are in the coverage gap. You're familiar with the coverage gap in Georgia?
Yes, ma'am. And the statement that's been made by some who have brought this question before, although I don't mind addressing again, is this bill addresses the coverage gap. The coverage gap is 100% of the poverty line and below. From above 100% of the poverty line, you're already able to apply for subsidies on the Affordable Care Act. This bill does nothing to affect that or say that that's not possible. What it tries to do is to address the cost of that private health care insurance so that that subsidy will go further. I don't know how we argue against that.
Can I share with you my personal experience? I personally know numerous individuals who earn between that $12,100 and some dollars and $16,000 and some $100. And is it not true they currently are not eligible to go on the exchange and purchase, and they are not eligible to have Medicaid coverage from Georgia? That's the coverage gap. That's the coverage gap that we have as a state for years created and let stand, and people actually die in that coverage gap because they don't have coverage. And so did you understand that coverage gap exists now?
Senator, I want to answer your question.
I'm going to stop. Yeah, go ahead.
That is not accurate. Those folks who are making above that dollar line that you gave are not bound from buying health care on the marketplace. They are not bound from that. They are also provided a subsidy to be able to do that.
No,
so
they
to
are
call
not.
I'll yield for your question.
I'm speaking to you as a person who has people that are related to me, as well as many, many constituents who are not eligible they don't have an insurance card. They're not eligible for our current Medicaid plan because they, as an individual, earn over $12,100 a year. And they're not eligible for a subsidy on the federal exchange.
That is
unless they are earning around $16,000 a year. It's a gap.
Senator, that is absolutely not true. And I've yielded for your question, and I want to point you to, I actually brought the Affordable Care Act up here with me, and I don't mind carrying it back to you to show you. If we go to section, let me check my sections on here. Section 14. Here, I got it tabbed. I knew that question was coming. Section 14A1C, I've got it right here, tab 40, 1401. That is not accurate. You can apply for a subsidy above 100% of the poverty line, and we've already got that tabbed and eligible. Doing what you're asking me to do would force those people off of private insurance and onto a government health care plan. And we just have a difference of philosophy. Maybe you think the government plan's the best. I think private sector innovation's the best. And if we disagree on that, I still am your friend.
Thank you for yielding, and I'm sure we'll continue this conversation privately and publicly, and there'll be many people coming to the well about it. So thank you.
Thank you, Senator. Mr. President, if there are no more questions, I'll yield the floor.
You have more questions. Chair recognizes the senator from the 52nd.
Thank you, Senator, for bringing this bill. Will you yield?
Yes, sir.
So it's true that the Medicaid will cover up to 100%, and that those in the 100 to 138% are eligible for subsidies.
Yes.
Is it also true that according to the Kaiser Family Foundation, that an individual making $13,000 with the subsidies would pay $22 a month for their insurance.
If the senator so states, I'm certain that he would not be inaccurate.
Thank you, Mr. President.
Mr. President, if there are no more questions, I'll yield the well.
You have additional questions.
Yeah. Mr. President, I'll yield the well because I think some other people want to come up here and give some
Absolutely.
facts.
Thank you, Senator. Chair would like to recognize the minority leader to speak to the measure.
Mr. President, members of the Senate, you know, we have this important measure before us, and it seems hard to believe we can't seem to get our hands around what we're actually doing. The author of the bill says this isn't Medicaid expansion. First of all, if you do a 115 waiver and you cover, 10,000 homeless people, you're helping expand Medicaid to cover those people. This is a Medicaid expansion. This is adding people to Medicaid. Now, we don't know, and that's a problem to all of us here. We don't know what we're doing because we could be putting a plan forward that doesn't cover the 240,000 people that are under 100% that are not presently covered. We could be having a plan here that excludes many of those people for various reasons, work requirements or other situations. And so we could be doing a waiver plan that covers 15,000 or 20,000 or 30,000. That's problematic as a legislative body that we don't know what we're doing. Second of all, we're not being honest about what we're doing. That's problematic. I come down here saying to all of you, and I want Medicaid expansion. I want to cover as many people as possible. And people will say to me, well, Steve, the chance to cover 200,000 is better than no chance at all or not covering anyone. You want to cover these 470, 480,000 people that would be under a full Medicaid expansion. But why can't you support covering possibly 200,000 people? It's better than nothing. And we saw in committee, we saw the Hospital Association and the nonprofit hospitals come down and support a bill. Say they were for this because something's better than nothing. But I'm here to tell you today that A, the author of the bill stated that we have 115 waivers in, we do. And there have been many approved. To clarify the question from the senator from the 6th, we're talking about the 90-10 match. And up to this point, no plan has been approved for the 90-10 match up to 100%. And if you don't get the 90-10 match, then this is folly. This is a bad plan. This is like Utah's proposal that would have covered 48,000 less people but pay $50 million, cost $50 million more. That's the road we're going down. And that's not where we should be going. You ask why, myself or others might oppose us. We have history on our side. We saw a plan that put more people under health care coverage and it be vilified and attacked from the moment it came forth. And we saw hypocrisy in the last election where we saw candidates all over the country, attorney general candidates, congressional candidates, some that were signed on to federal lawsuits trying to do away with pre-existing conditions. We saw them get on TV and say, well, we always wanted to cover a pre-existing condition in the middle of a campaign when they were in a lawsuit to do away with it. That hypocrisy strikes home to many people in this room and worries us about where we're going with health care, especially when we have no guarantees we're going to get what we're asking for, and we have no guarantees even what we're asking for because we're not guaranteed to go to 100% of poverty. It's may, not shall. We had an amendment that would have made it shall. We're not guaranteed to not put onerous restrictions to keep it even lower. That's problematic. And it's one reason I oppose this bill today. We, as a body, will try to do the best thing for the people of Georgia. And today's bill is not the best thing. If we vote it down, are we out of luck? No. We have Senate Bill 36, House Bill 37, that would be a full Medicaid expansion that could cover more people and do a better job. But let me go on a little bit more with the history of this bill. You know, last session we had a Medicaid expansion bill in. The session before we had a Medicaid expansion bill in. They never got hearings. I had Senate Bill 36, Senate Bill 106, no hearing. I do not care what the chairman of that committee states. That committee was one of the least open ones I have been at in my nearly 30 years in this body. I spoke for 2 minutes about the bill, commented, made some comments, and the chairman said I was proselytizing and shut me up. Senator 36 tried to make a comment. He quieted her. You know, I wanted to ask questions from the people presenting. You know, I went through days of a broadband bill where EMCs came and talked to the committee, and I asked them questions. Municipal Association came and talked to the committee, and I asked them questions. One of the most important measures we've got this session, and was I or any member of that committee allowed to talk to the people that testified, whether it be the Georgia Budget and Policy Institute that had troubles with this bill, or Georgians for Better Health, or the Hospital Association, who had supported full Medicaid expansion, although they said they supported this. I put to you that they'd rather have full Medicaid expansion. Or other groups. We didn't get to ask them questions. We didn't get into detail because that wasn't the purpose of that committee. It wasn't to vet the bill. It wasn't to improve the bill. It wasn't to have a hearing on the bill. It was to ram the bill through. And the reason we're ramming it through, without parameters or guidelines on what we're doing, is so that the governor's office can get a $1.6 million plus a match, $2.6 million, amount of money for a Medicaid waiver plan, and not even have it ready for us next session so we can see what we're doing, so that if we didn't like it, we could respond. The timeline in the bill is June 30th of 2020. So you can get out of here after the session before it's released and claim no responsibility in your reelection campaigns. That's what we're ramming through today, and it's problematic. You know, we can look, when we talk about subsidies under Affordable Care Act, and we're talking semantics about whether or not you do have subsidy. I think you do have subsidy if you're in the 100, 130 range under the ACA. But if you're making, a family of 3 is making less than $28,000 a year, the only real course, the only real option to have health and care is to be under the Medicaid expansion, because you don't have the financial wherewithal to get decent plans in the private marketplace. And I won't go into it at length. I know other people want to talk, but the 1332 waiver is also disconcerting, because right now we see that there may be efforts. When we talk about high-risk pools, and we've been talking about it for years. I had it in a brochure years ago talking about a high-risk pool and creating it. You know, it can help an insurance marketplace. But the trouble is you have to fund the high-risk pool. If you put a lot of people with bad health conditions, if you put all the cancer people in a high-risk cancer pool, it's going to cost a lot. And if you're a normal person, you're not going to be able to afford it. So it has to have a lot of public funding to fund. And we're not talking about where that's going to come from or how much money we're going to spend. You know, you can make, under the 1332, there are concerns that we could make some plans cheaper by changing the coverage guidelines, but make the coverage not sufficient to help you when you're sick. Or to make those plans get rid of some of the more sick people by a high-risk pool, but then other people can't afford the coverage because we haven't built the mechanisms in place. The House Ways and Means Committee stated that the Trump administration actually may be moving to try to allow states to reduce coverage in some cases. For some people, increase costs. For some people, reduce costs. You know, there's concerns, a lot of concerns that we have that we're not going in the right direction here. And I want you to understand that we know that if we do full Medicaid expansion, we will bring almost $3 billion to Georgia in medical and federal dollars that will help our businesses and create 56,000 jobs. We know that everybody under $138,000 a year, 138% of poverty, are people who need help to get insurance. And those people making between family of three, I'm not, single person, family of three, if you're making 20, 28, you're working. You're making money. These are not, if you will, deadbeats. These are people trying to make it. And to us as a society to make sure they have health insurance, I think is an important social good. Ladies and gentlemen, today, as others will come up and talk about, this bill doesn't have safeguards. It doesn't have a backup plan. But more importantly, as we, as a deliberative body, decide what to do today, we should have had a bill that had flexibility in front of us so that if the researchers and the people developing a waiver plan went and said, can we get a 9-to-1 match up to 100%? And they said, no, it's going to be 2-to-1. And I'll tell you right now, if it's 2-to-1 and we only go to 100%, it's going to cost us more money to cover less people. And I don't think Kemp Care, I don't think this plan should be a plan that covers less people for more money. And we should also make sure that guidelines are in this bill for the 1332 waiver that protect people, to make sure that our values are in place. And I don't think that's there. I know there's other speakers, so I'm going to yield the well. I will yield for questions if necessary, but I know other people want to talk. I could talk about this for a long time. It's been a frustrating process, and frustrating today that even the concept of the bill itself, whether we're expanding Medicaid or not, is being disingenuous, because this is Medicaid expansion. Isn't ACA 138% Medicaid expansion? No, and that is a big problem. I yield for questions if there aren't.
You have no questions. Chair recognizes the senator from the 22nd.
Mr. President, but my light has been lit because I wanted to ask the Senator Noel questions. Is it not showing up on your panel?
I see you recognized as to request to front on my screen.
I'm sorry, I have both lit up.
Would you like to ask a question?
I would.
Do you yield, Senator?
I yield.
Thank you, Mr. President. Would Senator yield?
I yield.
Senator, I've heard you talk about a lot of different issues, and I just wanted to clarify a few things.
Thank you.
You mentioned $1.6 million. That's money in the budget for consultants. Is that correct?
Thank you. I'm glad you brought that up. Listen, we did not vote, or the Democratic caucus, myself, my colleagues did not vote against a supplemental budget that included $1.6 million for consultants on this Medicaid plan. We want, research done. We want information. $1 million match will come from the feds. We weren't against that. Thank you for your question.
And Senator, further yield?
I yield.
Senator, is that money being earmarked to develop a strategy on how to move forward with the expansion of Medicaid?
It is my understanding that the administration wants to get experts, that they now want the power that they took away prior to a gubernatorial election, was taken away from the governor's office prior to an election some years ago. They want that power back in their house. They want the department to be able to hire the best and brightest minds to work on a waiver plan, and that is why they're requesting the money.
Senator, further yield?
I yield.
Senator, given that we've already allocated money for the consultants to come up with an expert plan, do you think it would make sense if we delayed action on this bill until we got the results of what those high-paid consultants would consider is the best plan for Georgia?
I certainly think that that is a possibility that we should look at. We could, I would like to move forward through my bill, Senate Bill 36, of course, but we could wait until we have this plan at hand next session and sign off on it, make adjustments or give legislative input, and then have a waiver plan by June 30th, 2020.
And I'm sorry, Senator, further yield?
I yield.
Senator, I heard you mention that this plan and this bill does not have a backstop on it. Are you saying that if the state of Georgia is not approved for these waivers, then in fact we are back to ground zero again?
With the history going on on this item, you do have to worry about the politics. And the fact that they won't allow the latitude to go up to 138 if they think it's the best course for Georgia in this plan that we submit does create a situation where if we reduce the 2-to-1 waiver, we go the 9-to-10 match, we could be ending up going forward with a plan that costs more, covers less, or no plan at all. We don't have to submit it if we don't think it's acceptable. So I certainly agree with that concept that we're not allowing the broadest pass to get the best plan, and if they fail to get a good waiver response from the federal government, we could have no plan at all, and this could be effort and futility trying to cover these people.
Thank you, Senator.
Thank you.
You have no more questions.
Thank you. I'll also comment the senator from the 10th had an amendment that would have brought us up to 138, so we could have that latitude.
Chair recognizes the senator from the 22nd to speak to the measure.
Thank you, Mr. President. I rise in opposition of this particular bill, and one of the areas I want to focus on, there's a lot of problematic areas, but one of the areas I wanted to focus on was the Section 1332 waivers that have been kind of discussed here. And one of the things we could have done, but we engrossed the bill, was kind of address some of those issues dealing with the 1332 waiver, especially the concept of the use of short-term limited duration plans. Under the original ACA Act, short-term duration plans can be used, but they can be used actually for exactly what it says, short-term, which is basically about 3 months is where the Act reads today, or did read before new regulations came out. The reason why it was going to be actually short-term is because those plans actually have a lot of different limitations to them. Number one, they provide less coverage that is given in most of the plans that are out there. And that is not just myself saying that. That actually comes from HHS Volume 83, number 206, where they actually use this language. This is the language that was used in Health and Human Services, which is that the opinion of HHS is that a disadvantage of the 2015 interpretation of the ACA was that it deterred states from providing innovative coverage, that word, but the key thing is that while potentially providing less coverage. So it is actually acknowledging that the use of these short-term plans can provide less coverage because it deters states from providing innovative coverage that while potentially provides less comprehensive coverage is allowed. So that's not us just saying that less comprehensive coverage is allowed under this. That is actually coming from HHS, that they are acknowledging that less comprehensive coverage is allowed under the short-term plan. Now, also under that particular regulation, it talks about the fact that these products can be used, they can be more attractive to consumers, and these are quotes in the language, more attractive to consumers, presumably because of lower premiums, but that happiness, and this is me, that happiness will disappear if the lower premiums take place, but the person actually gets more sick, because those lower premiums aren't going to necessarily cover something that is going to be more catastrophic towards them. And so it has actually inadequate coverage. And HHS is acknowledging that. It is saying that it's going to be more attractive to consumers because of the lower premiums, but it doesn't have the same coverage. So why were the plans basically discouraged? Number one, they can be written to exclude pre-existing conditions. Number two, some of those pre-existing conditions can be maternity care and also mental health care. An April 2018 study showed that 43% of short-term plans did not cover mental health, 62% did not cover substance abuse, which obviously is a problem, and 71% did not cover outpatient prescription medications. But all of these things actually could have been addressed if we didn't engross this bill. It's not that we didn't have an opportunity to address these issues. They could have been addressed. Basically, what we could have said is simple language that we wanted to basically follow the ACA language as far as the guardrails are concerned. we could have went ahead and addressed these issues to where we would make sure that these short-term plans were short-term. Second major problem here is this may not pass, what the HHS did may not actually pass court scrutiny. So we may actually go out and create some of these waivers, but it may not pass court scrutiny. Once again, that is not myself just saying that. That comes from a case of Azar versus Stewart. In that particular case, under 1115 waiver, which was decided, under 1115 waiver, the state of Kentucky actually created waivers that would have higher costs for non-emergency transportation. They would have higher cost sharing revenues. They also would have work requirements. The court vacated that waiver, stating that the changes were not consistent with what Medicaid was about, which is protecting vulnerable populations. Now, they actually remanded that back to HHS, where HHS came back and said, no, we're correct. So it's still going to go back into litigation. But here's the key. What the court was saying was, these changes you have made are not consistent with the legislation that went through with Medicaid and also with the ACA. With these changes that HHS has made just recently, the regulations that I read, they're also not consistent with the original ACA bill, which was that we basically wanted to put most persons into one pool. And that pool was going to be to where we had persons who may be sick, we have persons who were well, we have persons who are old, we have persons who are young. And that pool would allow it to be in a functional insurance type of pool. What the HHS has done through their recent regulations is they've created different pools. And that's not consistent with the ACA. And there's going to be litigation, and it's going to be similar to this case that I just cited, which is just a recent case, 2018 case. And I would anticipate the court to say that the bottom line as far as the ACA was concerned is that we were trying to create one pool to cover cost, and that this does not do that. It creates multiple pools. And in fact, our bill says that we're going to have multiple waiver provisions. I don't believe that the court is going to allow that to take place. And where will we be at that point in time? We've created these waivers, but yet the court is going to kick it out and say it's not going to work. All of this could have been corrected. We're talking about 100%, 138%, and that can be somewhat very technical. But as far as talking about the guardrails to make sure they follow the ACA guidelines of 2015, that could have easily been done right here today, but we engrossed this particular bill. And so that's why, Mr. President, I rise in opposition to this particular bill. And I know there's many lights on, but I would entertain any questions if I have any.
You have no questions.
Thank you.
Chair recognizes the senator from the 45th to speak to the measure.
Thank you, Mr. President. I appreciate everyone's diligent debate over this topic, and I think probably everyone already knows how they're going to vote. But we are having the debate, and it's a good thing. And it's a good thing for those people that are going to be writing those waivers to listen to this debate so they know our opinions, so that we get our input into it. But the main thing is about access to care. And we've heard about insurance. We've heard about deductibles. That's the main thing I hear from people who have existing insurance is they can't even meet their deductibles. Yes, their insurance premium is as much as their home mortgage payment per month, but then when they have to use their insurance, they can't meet their deductible. And unfortunately, after they have their heart attack, they go to the hospital, they go home, and they almost have another heart attack because of surprise billing. They think they have insurance, but they're actually not covered because there's ancillary payments that they have to pay to other providers. But I have to say that the best thing about this, even though a lot of people are getting up here complaining about it, we are literally taking a bite out of the apple. Is it the biggest bite you can take? No. But look at the past 4 years. We haven't even bitten the apple. So some progress is better than no progress that the minority party has been complaining about for years now. So here we are marching down the road. We're making progress, and it's a great day in Georgia. And I'm just grateful that we got a governor down on the second floor that recognizes this and is moving the ball forward. I would like to say, no one has said since they stood up here, thank you. This is a very hard to describe subject matter. It's hard to articulate because it has a lot of acronyms. There's a lot of different levels of government, whether it's federal, state, or the local level. But sitting right here in the back of the room, we have Andy Miller with Georgia Health News, who has done a fabulous job. And I do call you out because you help me understand it better. We have Ariel Hart, who is a specialist in health care. Thank you, thank you, thank you. There's actually others back here that help us explain it. The other group I want to say that I haven't always agreed with is Georgians for a Healthy Future. Now, they are a little bit more left-leaning, but by golly, they keep the subject on the topic on the table, and that's what we care about. And that, in the last 4 years, is one of the reasons that we're sitting here today, and we can articulate in this debate. I also want to say thank you to the Hospital Association. Yeah, they've moved the ball down the line. And yeah, we've had 4 hospitals or 6 hospitals or whatever it is closed in the last few years. That's an atrocity. Yeah, they're moving it down the line. But more importantly, the providers. The providers are the ones that are moving the ball. They're the ones where the rubber meets the road because they're doing the job every single day. And unfortunately, just like the senator from the 32nd talked about, a lot of them are getting out of the business. They're not taking care of these patients that we want them to take about because their revenue stream is so little on the dollar. They can't even turn their lights on in their clinics to be able to keep the doors open. So thank you to those people. Waivers have been around for a long time, and everybody's up here talking about, oh, it's a new day, it's a new thing. We have had waivers, and we have talked about these waivers, and every time you vote on the budget, you're voting on a waiver. Those waivers have been in the budget with mothers and babies, and thank God they've been in the budget because we want them to be able to take care of that. Those have been line items in the fiscal notes that we have had previously. One of the complaints was, where's your fiscal note on this? We've had fiscal notes out the wazoo on this, and everybody in this room already knows it. Insurance, the 1332 waivers, we are moving the dial. We are moving the dial because these are options. These are state innovation waivers. And yes, we've heard from the president, we've heard from CMS. They want states to think out of the box. And thank goodness now we are thinking out of the box and we're looking at our insurance infrastructure system. We are getting flexibility. We are saying Georgians are unique. We're different from Alabama. We're different from Mississippi. We're different from North Carolina, South Carolina. We want our own plan, and that's what we're requesting. Yes, there are other waiver applications in there, but we want to be the first. What is wrong with us being the first in the United States to think out of the box, to put Georgians first, and to put more people with accessible health care? What could be worse than that? And why are you standing up here criticizing us for that? It just doesn't make sense. The reinsurance program, Alaska, Minnesota, Oregon, Maine, New Jersey, and Wisconsin. We could become one of the first states in the Southeast. That's a great thing because we're reducing cost and we're allowing people to have access to insurance, and we're also subsidizing it. We were talking previously about the coverage gap. This is the exact innovation waiver that answers the issue of the coverage gap. And thank goodness, again, that we're doing that. These are people that are caught in that gap, and we're trying to help them with our best. The Section 1115 waivers. CMS did issue that waiver to all the governors wanting flexibility. I remember going downstairs and talking to Governor Deal right before he left, almost a year ago in January, and I said, Governor, why aren't you working on health care? He was working on criminal justice reform. I've told this story before. He said, Renee, I'm leaving it for the next governor. Thank goodness this next governor is stepping up to the plate, and he's being innovative, and he is creating that flexibility, and he is thinking about every single Georgian. The other thing I want to talk about, who is the beneficiary of this bill? Now, you can talk about the poor folks. I want to talk about the taxpayers of Georgia, because right now we are funding 100% uncompensated care for these folks that we're trying to get onto the rolls. That's a good thing. That is the 11 million Georgians and all those folks that are paying taxes. A lot of them don't pay taxes, but the beneficiary of this bill is the taxpayers of Georgia, because we're drawing down, just like on transportation dollars. We send all that money up to D.C., but we don't draw it back down. Now, finally, with this bill, we're drawing that money back down to Georgia, and we're helping with that uncompensated care. That's a good thing. When you go down to Albany, Georgia, and rural southwest Georgia, and you understand the complexities of rural health care, and you understand that this bill helps, this is my passion. This is a lot of your passion, and that's why this bill's coming. I know the minority leader said, well, what are we doing? What's the backstop? Well, by golly, we are the backstop. And it's a good thing we're the backstop, and it's a good thing we got that passion in our heart, and we want to move the ball forward. I want to talk about the disparity. We know there's disparity. This bill answers the question, what are we doing about disparity? We are helping more Georgians. Senator Lucas, oh, I'm not supposed to say that, I'm sorry. The senator from down at Macon, the senator from the 26th, excuse me for saying your name, I'm not supposed to say it. That's okay. I know he loves me. He said a bite out of this apple is better than no apple at all. And I agree with you 100%. That is exactly what we're doing. We're doing innovation. We're thinking out of the box. We have a great new senator, the senator from the 19th, that's doing a great job explaining this very complicated system. I want to just close out and say one thing that has not been talked about that is very, very, very important. Some of the people that we're talking about that don't have access to care, they have a dual diagnosis, whether they have coronary artery disease and they also have schizophrenia. A dual diagnosis, these are the most complicated people that we take care of. They're also the people that take the most amount of money. So the per member per month that we have to pay out in that uncompensated care is huge. And this allows us to have more of those people to get those federal drawdown dollars in that uncompensated care. So we are the backup plan, and don't let anyone tell you there is no backup plan. We are the backup plan. We have that passion. We have that commitment, and we are moving the ball forward. Thank you very much, and I yield the well.
The chair recognizes the senator, the patient senator from the 26th, to speak to the measure.
Thank you, Mr. President. I tell you, if I could sing from down here, I'd sing the song, Here We Go Again. You know, longevity, everybody wants to live a long life. I've listened to all the conversations. If you go to Canada and you play football, and it's a bum on the street that lives in Canada, you pay for his insurance. They take it out your check. If you want to play football in Canada, they take it out your check. We have sit and talked about ACA, the minority party. And some of you are my good friends, but we disagree on this issue. We disagree. Number one, the ACA, if you looked at it, you had to make $16,000 in order to apply. ACA wasn't free. The Medicaid expansion was supposed to take care of those who did not make $16,000 downward. What you're asking for, we're going to go to $12,000. So what happens to those folks who work in the hospital, who clean the beds, clean your bedpan, do all those necessary things to keep the environment that you're in clean, that make more than 12,000? What do they do? They're not covered. You're talking about the 1132. What 1132 says this: provide coverage that is at least as comprehensive as without the waiver. Provide coverage that is at least as affordable as without the waiver. Cover at least a comparable number of state residents and does not increase the federal deficit. Now let's talk about ACA, because that's all you've been talking about. Number one, you had an income tax requirement. That's what the Supreme Court ruled that they could do. That was to take care of your sicker crowd, your older folks. Young folks don't have all those health problems. But young folks don't necessarily buy insurance to cover themselves either. They go out and have a good time and figure somebody else is going to take care of it. Prime example. I was young, I rode a motorcycle. I rode it all over this country. But I had health insurance because I had a family. But there were guys who rode motorcycles, and when you got to Florida, they took the helmet off because Florida has a no helmet law. Now, if you hit the street, have a wreck on a motorcycle, your head hits the cement, think about that head. What's happening to it? It's bouncing up and down on that pavement. Now you're a vegetable, and here we go again. We got to take care of you because you didn't prepare to take care of yourself. When you took out the income tax requirement, and that's what I call the majority party at that time did, that threw HCA into a scramble because now you had no way to pay for the subsidies that you were giving other folks who had all of these health problems. Now here we are in Georgia. I've traveled this entire state talking about rural health care. You know, a heart attack or a stroke doesn't care anything about partisanship, race, or age. When it hits you, it hits you. And who sees about you? Now, y'all saying we ought to be glad because now y'all decide to take a bite out of the apple. You had a chance to take a bite and cost us $21 billion. And everybody talking about, well, you know, the government going to go out of business. They might not be able to pay the bill. But the other states took the money, and they took the money that Georgia's put in the pot. But the government going to go broke. How does the government go broke when they got a print press that print it? How? Ladies and gentlemen, we need to just get off this partisanship when it comes to health care. We need to get off of it. We need to try to figure out the best plan. And I said to you again, that's why I did not agree with engrossing. I think we should have had a discussion with the governor prior to this. See, you talk about a waiver. Do you understand? You don't know what the waiver is. You telling us what it's going to be. You don't know what it is until he applies for it. And then you got a 60-day comment period. That's when you know what the waiver is. Every waiver that's been applied for, none of them have gone under 138% of the poverty level. None of them. They came up with innovative ways of how to do things and inclusion, but none of them went under 138% of the poverty level. So while we are sitting here talking about health care and helping folks, let's tell, I'm not going to call you a lie, let's tell the whole truth. not part of it. This is about money. Yes, there should have been a fiscal note. Because when you talk about cutting to 12,000, you talking about $4,000 difference. That's what you're talking about. Things ain't going the way they ought to go anyway now, I'm telling you. The governor wanted to give teachers $3,000, the House cut it to $2,700. That's $300 short. Revenue, at some point in time, is going to slow down. And I think it's slowing down right now. So we've got to look at it. But what the thing that we most certainly have to look at, I pay for my insurance. There's no free ride for David Lucas. I got a deductible. I got to meet that. But yet, when I was laying in that hospital bed, they added to my bill because they had to take care of that uncompensated care that they gave everybody else. And those of us in here are fortunate that we can get health insurance. So we ought to think about that added cost to our insurance because other folks don't have the wherewithal to pay for it. The most expensive health care in this country is the emergency room. And many folk don't have the wherewithal, so when you see them, they're real sick. And they're in the emergency room. You know, when my last hospital stay was in October. I was cutting grass, and I got a riding lawnmower. I'm cutting the grass around my units and stuff. I finished cutting the grass, and I sit back on the seat of the lawnmower, and I just took me a deep breath. And when I took that deep breath, something just didn't feel right. I didn't hurt or anything. I said, something just ain't right. So I went home, put up the lawnmower, took me a shower, took me 2 Tylenols, and laid back. That was about 3 o'clock in the afternoon. Woke up about 7 o'clock. Wife walked in the door, and I said, look here, take me to the emergency room. Now, prior to that, I had called my heart doctor. I said, man, things don't feel right. So I go to the doctor. He said, well, David, we probably what we need to do is get you a cath, but your insurance company said they want to give you a stress test first. So I went on home. Took the Tylenol and rest, and then when my wife came in, I told her, take me to the emergency room. But what I was thinking about, you know, what am I sitting around here for? I got health insurance. I got to worry about paying no bill. I got health insurance. I got a card. So when I get to the hospital, the only thing they ask me, can we get your insurance card? I'm lucky. Now suppose I'd have ended up doing what the health insurance company wanted me to do, to take the stress test, and had the heart attack on the walking. I'm telling you, things ain't right, y'all. We've gone too far with the partisanship on this particular issue. We all ought to be trying to find a way to get health care for Georgians because it's costing all of us. As one person said, that you're talking about the poor. The poor. I've been poor all my life. From coming up from eating sardines and crackers and a Pepsi Cola to getting to the General Assembly where I could get a steak and stop eating chitlins. I'm telling you, our conversation has to change. It has to change on health care because it is the number one major cost, period. We didn't have a problem when the banks got in trouble. We bailed them out. You don't call that corporate welfare? This is an issue that touches everybody, and it reaches across partisanship, race, and youth. And we are going to have to deal with this particular issue. And money is one of the ways you deal with it. The problem is, how do you deal with it? Who pays for what? Whether or not you can get the best deal on these things. That's the reason insurance companies deal with in-network and out-network, trying to get a price to pay for compensated health care and reduce the price that you pay. If you go to Cuba, Cuba has life expectancy is higher than those in America. And they don't do nothing but smoke cigars and drink rum. But their life expectancy is higher than those in America. That's because they got clinics every 2 or 3 blocks. Got doctors. And they export it. That's how they bring their money in. They export their doctors and do a lot of trading to bring money into Cuba. But ladies and gentlemen, I just want to say that what we've got to do, we've got to back off this thing on this partisanship about health care, because it is messing us up as a state and as a country. Health care is needed. Folks need it because when we get it to them, it reduces our costs. Those of us who pay to get health care. So I just thought I'd bring it up because there has been some misnomer about ACA and how ACA operates. ACA is not free. You got to pay for it. The problem is those folks between $16,000 and $0 who don't have it to pay. And now you're going to exclude $4,000 worth of income, which means that the folks that work in the hospital to see about me and you when we go won't be able to get health care. Now, that's basically what you're saying. So I hope you think about how we deal with this, and there needs to be some more discussion on it, and that was the reason that I opposed the so-called engrossment, because I think the discussion has to go a little bit further than where it is. Everybody's trying to find out how we do it, but the problem is nobody has figured out how to make it work. So, ladies and gentlemen, I will yield the will. You don't want to ask me any questions because I can answer every last one that you bring to me. Because I know what the act does. I sold it. So I just say that you need to think about what you're doing, because you can't go back home and tell the folks you did something for them and you didn't do a thing. And that's what you want to tell them. You want to tell them you didn't do a thing. You messed it up is what you did. So let's look at what we're doing and try to figure out a way to work across these lines to try to give us the best deal we can get on health care. And remember, none of the waivers go below 138% of the federal poverty level.
Thank you, Senator. We have a long list of folks, senators, signed up on both sides of the issue or requesting to speak, just as a reminder to the body. I'd like to call on the senator from the 52nd to speak to the measure.
Thank you, Mr. President. I again applaud the senator from Vidalia, the governor's floor leader, for bringing this bill forward. In 2014, in my first term here, I voted with many of you not to take the governor's authority away. I'm going to be voting today to give him that authority back, so depending on how the votes are, I may be the only consistent vote in here on that issue. I realize some of you would like to give him more authority than he's asked for, but we have to have faith. We've got a brand new governor. He's moving aggressively. Doesn't have this budget yet, but he wants to get a plan to the federal government. He's moving aggressively here quickly to do something, and we need to have faith that he can do it. Yeah, we all have questions. It may not be the exact plan we would do, but I have faith that he's had some discussions and believes that he can make this happen. I did want to reiterate the point of those above $12,000. If you go to the Henry Kaiser Foundation site, which I think those on both sides of the aisle have some faith in their numbers, they do say that if you make $13,000, you're above the 100% poverty level, but with a subsidy on that, which is 94%, that drops your premium to $22 a month. So I don't think they're being left out in this plan. I do think that, you know, we all don't know, is the federal government, the state government going to make all this happen? I've got faith that, that those in the administration are going to do that, and I would urge your support for this bill. Thank you.
Chair recognizes the senator from the 42nd to speak to the measure.
Thank you, Mr. President. Colleagues, first I want to say that I'm very glad that we are having this conversation. I've waited 9 years as an elected official here in Georgia to have this conversation in a serious way about covering more Georgians through the Affordable Care Act. And first, I do want to commend Governor Kemp and those of you on the other side of the aisle for helping bring us this far. I especially want to thank my Republican colleagues in the Republican caucus who have worked us toward Medicaid expansion to enable more Georgians to have access to basic health care over these intervening years. You know who you are, and I do want to say thank you. I and other members of my caucus do thank you. So here we are. For the first time, the beginnings of a plan to cover more Georgians under the Affordable Care Act has emerged, and those of us in the Democratic caucus are opposed. Why would that be? Well, it's because this plan is full of holes and question marks. But with just a little bit of work, it could be something really great that we could all support. The first problem is that the plan, either there's a big question mark or, as described, it's a big waste of taxpayer money. Let me ask you, say you were shopping for some Coca-Cola. At one store, the case of Coke cost $5. But then in the store right next door, you could get a case and a half for $3. So why on earth would anyone in this room buy their Coke at the store where you get a lot less product for a lot more money? That is, in all likelihood, what we are preparing to do here. Under traditional Medicaid expansion, we can cover almost 500,000 people for approximately $213 million or less. There's a range in the fiscal note obtained by members of the House. I'm going with $213 million as a median figure. Under this bill, though, we cover 240,000 people for $374 million. So, 150,000 more to cover about half as many people. Who on earth would take that deal? Under Medicaid, we get $9 back for every $1 we spend. That's a 90% return, and now that is a good deal. That's a deal that every smart businessman would be delighted to take. But wait, aren't we getting some super special secret deal where even though we are only covering folks at 100% of poverty, when ACA explicitly requires you cover up to 138 to get the special 90% match, we're also somehow going to get 90%? Therein lies the second problem. Forgive us, colleagues, if many of us are a bit skeptical that the special deal will materialize, when 3 other states who have already sought it have been turned down, flat out rejected on that same deal by the federal government. Massachusetts and Arkansas, and then Utah, who also has been rejected, but their story is a little more complicated. Because we know that these states were turned down, it is more likely than not that we would only get a 67% match for our plan instead of 90%, and therefore we need a backup plan, like those other states had. The backup plan is you go to 138% of poverty, as envisioned under the Affordable Care Act, and then you get your 90% match. Unfortunately, the legislation before us does not have any plan B, and it hamstrings our governor. We should empower our governor to negotiate up to 138% to get the 90% match in the event that we cannot get it at 100% of poverty. It is a much better deal for us, and we cover a lot more people if we can get the 90% match instead of our standard 67% match from the federal government. I don't know about you, but I definitely don't want to pay 1/3 more to cover fewer people. We've already, in the intervening 9 years, we've already foregone around $40 billion in federal Medicaid money by sticking our heads in the sand over ideological opposition to the ACA. Now that we are beginning to take steps in the right direction, let's not let ideological blinders make us do something that will cost more, cover fewer people, and take longer than expanding Medicaid. That's another thing. We could get it done like that. It's been in place for 9 years. Instead, we have something that they're coming back to us in 18 months. That's going to take a lot longer. That is just a bad deal for Georgia taxpayers. Not being on Health and Human Services, I have to presume that these questions are why committee members were not permitted to ask questions when the bill was heard in committee. It's got too many problems to even take the risk, apparently, of allowing questions. Too much risk that we will look foolish rushing forward with this to even allow committee members to ask questions. Georgians have always supported Medicaid expansion, and the numbers have increased. One of the reasons the numbers have increased is because we've had a rural health care crisis on our hands for many years now. And we also have had the best, cheapest, and easiest solution bopping us over the head. I hope that the House improves this bill to allow coverage to 138% of poverty and empowers our governor to pivot to a Plan B if necessary. Then I could happily cast my yes vote. Thank you, Mr. President. I'm happy to answer questions if there are any.
You have a question. Senator, do you yield?
Certainly.
Chair recognizes the senator from the 19th.
Thank you, Mr. President. Senator, do you yield?
Yes, I yield.
Senator, the rules you cited for CMS and Treasury were rules that were promulgated in 2012. Are you aware of that?
Yes, and I know that there have been new rules, and I also know that no state has gotten the deal that you say that we are seeking.
So you are aware that new rules were promulgated in October of 2018?
Yes, I am.
And you're aware that no one has been turned down at 100% waiver
No one
since
has
October
gotten through either, isn't that right, Senator?
Under the old rules, you're absolutely correct.
I don't believe anyone's gotten through. States have been turned down. And the reason for that, colleagues, is because it's going to cost the federal government a ton more if all these states come in. It will cost the federal government too much money, and they don't want to be on the hook for it, so they're saying no. The special deal is under ACA only.
You have no more questions.
Thank you. I yield the well.
Chair recognizes the senator from the 28th to speak to the bill.
Thank you, Mr. President. Earlier, the senator from the 26th said it best. We need to forget about the partisanship in health care. We needed the best plan for Georgia, and that's what this bill does. It gives the governor the ability to provide the best plan for Georgia. The minority leader said earlier today, this is Medicaid expansion. And for the last 3 sessions, I've heard him come to this very well and talk about Medicaid expansion. So we got to ask ourselves, what's the problem here? And we just saw one of the nastiest governor's races I've seen in recent history. It was a nasty primary. It was a nasty general. And at his inauguration, the governor vowed that he was going to serve all of Georgia, not just those who voted for him. And like we saw with the teacher pay raises, this is just one more example of the governor fulfilling his promises. And so now we've got to make a decision. And we've been using analogies up here. Well, there's a school bus going off the cliff. And there's 10 kids on that school bus, and we can only save 2. What do you want to do? Do you want to stand beside and pout that we didn't get our way? That's how this legislative body works. we work out our differences, if we don't get our way, but we can still help people, which in this case we can, we do that. And that's the decision you've got to make. My first bill, my very first bill, we passed out of here 55-1. And it was going to help people with hearing impairment. And when that bill came back, it had one word in it that was the same when it left this body. And that word was or. And it was on line 16. And it came back and it dealt with people's eyes. But you know what? It was a bill that still helped people. And that's what we got to do today. We have an ability to give the governor the ability to go out and help Georgia's citizens. So do the right thing and vote yes. Thank you. I yield the well.
Chair, Senator yields the well. Chair recognizes the senator from the 10th.
Thank you, Mr. President and members of this body. And we've been discussing and debating this bill for some time now, and I know many in this chamber feel as I do, that you really want to debate it a lot more. That's a lightheartedness now, by the way. But I'm not going to belabor the point of here regarding this particular bill, but there are a couple of things that I want to discuss because I've had the opportunity to have hundreds of people work for me. I've had the opportunity to see hundreds, if not thousands of people come in and apply for credit. And the number one reason why people have been turned down is because of bankruptcies. And the number one reason for bankruptcies in this state and across this nation is related to medical bills that they cannot pay. There's some in here that say that this is better than nothing. That others that say, I don't understand why members of the minority party don't get behind this and embrace this bill wholeheartedly. And I just simply want to say to those who feel that way, that our job as legislators is to perfect legislation. And if we don't do that, I'm not doing my job. I could not go back and talk to my constituents and tell them why I voted for something that I knew had flaws in it. And let me just say, I applaud the senator from the 19th. I applaud our governor for bringing forth this legislation, and as some have said, sticking a toe in the water or taking a small bite at the apple. But folks, we can do more in this state, and we can do better. Our state, when we're talking about $27 billion in revenues, one of the fastest growing and the number one state in this union to do business, we can do better. And as someone that's been in this chamber for 15 years, I want to do better. What this bill simply has done, as some have said, it's really not a Medicaid expansion. We're giving the governor the authority to apply for these waivers. There's also many here have said that no one who's ever applied for a comparable waiver has ever been granted permission from the government. Given those two dynamics, it would make sense to me that we should allow some flexibility in this particular legislation. I don't think we've done that. I don't think we've allowed that flexibility or given our governor that flexibility in the event that Georgia follows along with other states like Arkansas, Utah, and Massachusetts who applied for almost the identical waiver and got turned down. That's what we're dealing with here. This governor, I'm afraid we've essentially tied his hands by saying if you don't get this, you don't get anything at all. And for someone that's been in business for a long time and had the opportunity to serve on a hospital board for close to a decade and see the kind of dollars that's expended on indigent care, to me, that's just not good enough. I wouldn't be doing my job if I didn't say to the majority party and the senator from the 19th that there's a way to perfect this legislation, some simple things that can be done. Unfortunately, we didn't have that opportunity, but I'm going to share with you what that opportunity would have been anyway and what it would have looked like for those of us in the Democratic Party that's voting against this legislation. We simply would have added an amendment in there that said if this waiver that we are applying for, the 100% was turned down, then the backup plan would have given this governor the authority to go back to the government and say, what about 138? It would have given him that flexibility to expand, if you don't want to call it Medicaid, to expand the plan from Governor Kemp. Call it his plan. That's a simple fix to this particular bill. And to me, I didn't think that was asking too much for a legislation that has such dire importance and going to touch so many people. And in my capacity, professionally and personally, I've seen too many people that's been impacted and lives ravaged by the loss of essentially everything they've had because they've had to file bankruptcy simply because the loved one got sick and couldn't work. And I say to you and to my friends in this chamber, we are better than that. I say to the Chamber of Commerce who wrote this letter and put it on all our desks, and I'm a big chamber fan. I love the chamber and I love business and I love the status of this state being #1 in the country for doing business. But if you read that letter from the chamber, it has one word in there that always gets the attention of anyone that's ever been in business. It simply says halfway down through the second paragraph, SB 106 has the potential to reduce private health insurance. Folks, I don't know about you, but I don't want anything to pass in here that has potential. We need certainty in dealing with this particular issue. This bill doesn't provide that. And when we look at the amount of dollars that have been lost and expended on this plan, I say to all of you, we can do better than this. Thank you, Mr. President. I yield well.
Thank you, Senator. The chair would like to recognize the senator from the 36th.
Thank you, Mr. President, colleagues. The discussion's been going on interminably in Georgia about what we're going to do with the large number of uninsured Georgians that don't have an insurance card in their pocketbook or their wallet and who face dire consequences when they get these huge health care cost bills that we just heard the senator from the 10th reference. #1 cause of bankruptcy in this country, medical bills that are beyond one's ability to pay. And yes, we've urged from my party to expand Medicaid. We continue to urge it, and we had a very simple amendment in the Health Committee to take that 100% cap off and, as the senator from the 10th put, really enable the governor to have the flexibility to do what is needed, not to cap it. The other thing that's, that this bill is, it's enormously problematic. We've waited all these years. There's been all this vitriol spent by the GOP attacking Obamacare, how horrible it is, how bad it is, how it's going to be the ruin of the nation. And yet when they took control in Washington, Obamacare stood. They'd take vote after vote, trying to throw Obamacare into the trash heap of history. And it turns out people actually like having health insurance. And those who have health insurance are very concerned that we carefully approach these questions of expanding coverage because they're afraid their own insurance is going to get more problematic. You know, 90% of Americans, roughly speaking, have health insurance of some type or another. Now, much of that, they're underinsured, many of them. But they have a health, and they're in endless debates with their insurance company about what's going to get covered and when and how. So people are very nervous, understandably, about their own health care coverage. And then if you rattle the cage and swear that the expanding coverage to more people is going to be dreadful, then people naturally say, well, don't do that then because my health care is already compromised enough. So it's been unfortunate that some have thought it seemly to spread the vitriol about the Affordable Care Act. We're the only nation in the developed world, y'all, that doesn't have universal health care. Where did we get it wrong? Where did we get it wrong? And we see that we're paying the cost. The author of the bill said we need to be as efficient as we can with the tax dollars. I would agree wholeheartedly. And I'd say to you, if you just put out the proposition to Georgians, would you rather have your health dollars, your tax dollars that are going to health care, be matched 9-to-1 from the federal government? They'd say, yes, we'd choose 9-to-1. We'd choose 90% on the dollar rather than 67% on the dollar. They just would because anybody knows which bargain is the best. Anybody knows that. It speaks for itself. I want to take issue with, so we were not able in the Health Committee to fully debate this. We had very brief, I believe it was 3 minutes allowed to people that spoke that came before the committee. We were not accorded the time to question them, and we then were cut off when we attempted in the last 10 minutes that was left for the committee to say anything. We were cut off when we attempted to say things. So there was not a debate on this bill in the committee of any sort. We welcome the time that's been extended now to more fully go into the bill in its detail. We heard from the author, Medicaid is a failed system, and we all know that. Well, the big news is it's not. That's a false narrative that serves a purpose. If it's a failed system, then let's torch it. It's not a failed system. You heard from the lady from the 40th, senator from the 40th, that 60,000 Medicaid recipients that were polled by the Harvard study, overwhelmingly satisfied, 7.9 on a 10-point scale with the coverage that Medicaid afforded them. Then the response was from the gentleman from the 19th, oh, but the providers are very unhappy with the Medicaid system. They're not getting reimbursed at a decent rate. I have one question for you. Who sets the rate for the providers in Georgia? The state government. The rates are set right up here. So to say that Medicaid is failing because the providers are not getting paid enough, what you really ought to say is the state has failed to invest adequately in Medicaid. And the providers have been coming to us for years. Any of us that have been on the appropriations committees, on the health committees, have heard this phrase. We know that it is woefully low, the reimbursement rate. But that's a policy that this state government put in place. It's not the fault of Medicaid being a failed system. It's because we're trying to do it on the cheap. We're trying to do it on the cheap, and that's why you wind up with providers not feeling able to take Medicaid patients. Some don't take Medicare patients. And that's why you wind up with people showing up in the most expensive place to get health care services, and that's the emergency room. So Medicaid is a failed system, that's a false narrative. We could raise those rates, and we've done it from time to time in tiny increments, not enough. Not enough. The hospitals have taken a licking going back to the 90s when the Hospital Act was passed federally under Newt Gingrich's reign, and hospitals were pushed to the wall on making their business plan work. So we could take the provider rate and handle that right now if we chose to invest the money that we should be investing. And getting a 9-to-1 match. I kind of like 90% on the dollar. Go out and find any place else where your investment pays off to that degree, and invest it in Georgia's healthcare infrastructure, which is in dire need. Now, one more point about Georgia and how we've handled our health decisions, our health programs, our funding, our investment, our coverage, our care. We have alarming statistics. You know, we're ranked as having one of the least investment states in Medicaid around the country. Did y'all know that? We don't have a model Medicaid system here. We do not, because we failed to invest in it adequately. The uninsured rate, our state is 48th in the country of the high rate of uninsured people. We tie with 3 other states, but 18% of our folks uninsured. Infant mortality, that's when the baby dies. That's real life, that's real. We're 43rd out of 50 states. 43rd out of 50 states. 7.2 children out of 1,000 births. We lose them. Maternal mortality, I think people are opening up their eyes to understand that Georgia is 50th in the nation on women dying during the childbirth process. Life expectancy in Georgia is 74.8 years. That's 41st out of 50 states. These aren't good statistics. These are troubling statistics. We have caring people in our departments and agencies, you know, that work to try to change this data. But a core element is for people to have health insurance. Adult obesity, many of us struggle with it. 31.5% of our Georgians have adult obesity. We're 24th in the nation. On childhood obesity, we're 43rd in the nation. On adults who delay care because of the cost, we're 47th out of 51. That counts the District of Columbia as well. Children who didn't visit a pediatrician or dentist, 38%. 38%, more than a third of the kids in this state. Some of us had mamas and daddies who could afford to take us to the dentist. We never thought about it. You went to the dentist every year. Senator from the 9th, I bet you did from your beaming smile. Yes, many of us we had that kind of opportunity. 45th in the nation we are on children who are not able to visit a pediatrician or a dentist. Children who didn't receive needed mental health treatment. We're 50th in the nation. These are not my numbers. I didn't go home and make them up. This came from nationally vetted studies. And I can refer you to them, but I won't take the time. Commonwealth Fund has done a lot of this statistics. And finally, we just had a bill in Health Committee this week around HIV/AIDS. You know, the sad news is that we have the highest rate in the 50 states of HIV/AIDS infection. And we're in a discussion with our department about whether they're going to cover these new drugs that turn a death sentence into a person who's able to work and has their health because they have the medication and the treatment. There can be a tax-paying citizen, stay on the job, as opposed to piled up down at Grady in a bed on the way to the cemetery. But it's all about investment and believing that rather than punishing people for not having enough money to go afford their own expensive health care insurance, we come up with a system that covers everybody. And that's why we're pushing so hard on the question of go get the 9-to-1 match, go get the 90% match, go to 138% of poverty. And yes, let's look at all kinds of ways that we can expand coverage and invest. But people, we've turned down, how many $1 billion is it now? Isn't there something on your desk about that? 21 billion? And the studies that came straight out of Georgia State told us when the Affordable Care Act was made into law, good people in Georgia, you can bring 40, I hate to even say the number, it seems unbelievable, billions upon billions upon billions of federal dollars into our state's economy. And finally, when we talk about rural Georgia, and the former chair lady, among many others here that work in health, either appropriating the dollars or working on the policy, and those of you who represent the citizens of rural Georgia. We have a dire situation
you get people covered, you get them with an insurance card, and you bring those dollars into these rural economies, and you keep these hospitals open, and you reimburse providers so that they can stay in business and can accept Medicaid and can accept Medicare, and you've got solution. Well, then we're on a solutions path. It's great we're having this discussion, but why would we, as a legislature, agree to be walled off from what that waiver is going to look like? Because this bill, as was pointed out by the minority leader, this bill puts off till after our next legislative session is over and we're back home running for seats or running for our lives, whatever. That's when what the waiver looks like would be even known. So we're disempowering ourselves to participate in passing a bill that stretches the deadlines for this out so far, is non-specific about what the waiver would look like, and there's no bite at the apple that we get, this big old apple we're talking about, as a legislature, to perfect a waiver, to perfect what expansion looks like, to perfect an approach to coverage that makes sense for Georgia. So I hope it's a bit clearer why we're voting against this bill as Democrats. We want full Medicaid coverage in Georgia. We want to address these dreadful statistics that we have as a state. Nobody here is proud of these statistics. Nobody here thought that you were lending yourself to producing statistics like that, but I say to you, there's a road forward out of this, and that is good, sound health policy and adequate investment. This debate will continue. I'm sorry that we could not bring amendments and have the full options before us as we vote as policymakers. I'm sorry that whatever comes into effect will be delayed until mid-2020 before we even know what it looks like, before there's even a public comment period. And I'm sorry that we have a bill before us that cuts the legislature out of the final decisions on this health policy. I'll yield the well, Mr. President, if there are no questions.
You have no questions.
Thank you.
Chair recognizes the senator from the 6th to speak to the bill.
Thank you, Mr. President. Transparency. Let's be clear, there's been nothing transparent about this process. Medicaid expansion and this innovative waiver bill has been rushed through. The senator from the 45th said anyone on HHS knows what the waiver will include. She indicated, well, the governor has checked into Washington, D.C., and the plan and the waivers are well thought out. Well, that's not true, because if there was really a plan, there really was, and if anybody really had any clue what this was going to do, then why in the world are we going to pay someone $1.6 million to figure it out for us? It just doesn't make sense. And so who's the beneficiary of this bill? Well, whomever's getting that money, I would say. There's been a conflation in terms of the waivers here. There's the 1115 waiver, and then there's the 1332. In terms of the 1115 waiver, that deals with partial Medicaid expansion. Doesn't matter what you call it. It's partial Medicaid expansion. If we fully expanded, approximately 500,000 people would be covered. Partial expansion is going to be half of that. And guess what? It's going to cost twice as much. Y'all, that's crazy. And let's be clear, no other state has gotten approval for a 90-10 match for partial expansion. Now, what I've been told is, well, we've gotten assurances. People up in D.C. have said, Georgia, don't you worry. Well, who did we get that from? And would it be the same people who have promised our farmers in Southwest Georgia billions of dollars in aid, but would rather play politics than help the people of this state? We are gambling. We are gambling with the health care of Georgians, y'all. We are playing politics. Now, there was a reference, and the senator from the 19th was very smooth in his presentation.
And there was a question from the senator from the 18th about, well, tell us about the success stories of these innovative waivers. And he talked about Maryland and Alaska and how the costs have gone down in those states. Those states have expanded Medicare, Medicaid fully. That's why the costs have gone down. Now, let's talk about the 1332 waiver now. So we've got partial expansion up to 100% of FPL. Now let's talk about 1332 waivers. When we talk about a 1332 waiver, what we mean by that is that there's going to be a request by the state of Georgia to waive certain protections under the Affordable Care Act. Now, what the senator from the 19th said is this is going to allow us innovation. We're going to be able to innovate. Well, let me be clear. There is nothing innovative about short-term health plans that don't cover pre-existing conditions. There is nothing innovative about association health plans with higher premiums for older adults, residents of rural areas, women of childbearing age. Association health plans, they basically make being a woman a pre-existing condition. And what we know in terms of the premiums with respect to those plans, for women 30 years old, they're 30% higher. So what are we doing? There is nothing innovative about a race to the bottom with low-cost plans that cover nothing. And just to talk about the senator from the 36, she said it best. She said, we're trying to do it on the cheap. That is exactly what we're doing. There is nothing innovative. It is back to the future in terms of offering junk plans that offer absolutely no consumer protections to the people of this state. If you think that that's innovative, then y'all, I got a bridge to sell you. I yield the well.
Senator from the 9th is our last senator requesting to speak to the measure. Recognized as Senator from the 9th.
Thank you, Mr. President. I know the hour's late. I appreciate the senator from the 19th bringing forth this bill. I'm going to borrow a statement he said that Medicaid is a sinking ship. And we've heard from our members here that there is participants in Medicaid that are satisfied with the services they receive. And I don't discount that. But what I know is that we're seeing facilities close all over the state. And I don't believe that more of the same is the appropriate prescription. Medicaid as is more of the same. And I'm no economist, but I do understand that 20%, if you're recovering 20 cents on the dollar, you can't make that up on volume. That's why we're seeing fewer and fewer providers accept Medicaid around our state. And even though we have people that are very happy accepting it and they're getting care, as they have fewer and fewer people to go to, they're going to have less options. So the way I see it today, there's two arguments. One is more of the same, a lot more of the same. And second is that we get to work on a solution that will benefit people all over our state. Will it be perfect? I hope so. I really do. But if it isn't, then I'll borrow another statement from the senator from the 45th. We'll take another bite of the apple. I hope you'll support this bill. I yield the well.
Senator has yielded the well. Chair would like to recognize the senator from the 19th to close debate on the measure.
Thank you, Mr. President. Thank you, colleagues, for what I believe now has been several hours of debate, and I appreciate your candor, your honesty, and the ideas that you passionately spoke about. We have an option before us. It's an option to take and reform a system that I believe and many of you believe is broken. It's to offer people a hand up and not a handout and reform a Medicaid system that today cost a total of $11 billion. You heard the senator from the 9th say sinking ship, echoing my comment. And I do believe it's that. Medicaid in Georgia is like the Titanic. It's costing us $11 billion, $3.3 billion in state funds. And it's got 2 million Georgians, or 1/5 of all Georgians on board. The plan you've heard, suggested by the minority, is to add more people to that ship. What I'm asking you to do today is to throw those people a lifeline. Let's do something different. Let's give them a life raft. Let's reform this program, and in the process, let's reduce the cost of health care insurance for all Georgians, above and below the poverty line, with a 1332 waiver that's innovative, constructive, and provides Georgia solutions to Georgia problems for hardworking Georgians. Thank you so much for the time you put into this today, and Mr. President, I yield the will.
Is there objection to agreeing to the report of the committee which is favorable to the passage of the bill? The chair hears none. The report of the committee is agreed to. Shall the main question be now put? Are there any objections? The chair hears none, and the main question is ordered. Shall this bill now pass? The question is on the passage of the bill. All those in favor of the bill will vote yea. Opposed, nay. The secretary will unlock the machine. For what purpose does the minority leader rise?
Parliamentary inquiry, Mr.
State your
President.
inquiry.
Isn't it true that we could achieve the goals the Senator 19 said by covering more people and providing better coverage if we would adopt Medicaid expansion in totality rather than pass Senate Bill 106?
That's for each and every senator to determine for themselves. On the passage of the bill, the yeas are 32, the nays are 20. This bill having received the requisite constitutional majority is therefore passed. Chair would like to recognize our majority leader.
Mr. President, as much as I hate to, I move that the Senate stand adjourned until 10 o'clock on Wednesday, February 27th.
The Secretary will read our announcements.
The election for the DOT board member from the 12th Congressional District will be held today in the Senate chamber at 3:30 p.m. Rules will meet upon adjournment in 450 of the Capitol. Ethics was canceled. Regulated industries and utilities will now meet at 3 p.m. in 450 of the Capitol. State and local government operations was canceled. Banking and financial institutions will meet at 4 p.m. in Mez 1. Finance, Health, and Human Services Subcommittee will meet at 4 p.m. in 307 of the CLB. Natural Resources and the Environment will meet at 4 p.m. in 310 of the CLB. DOT Board Elections, District 12 will meet in the Senate chamber at 3:30. Agriculture and Consumer Affairs will meet at 5 p.m. in 450 of the Capitol. Transportation will meet at 5 p.m. in 310 of the CLB. Special Judiciary will meet at 6 p.m. in 307 of the CLB. Mr. President, that concludes the order.
The chair recognizes the senator from the 31st for an announcement.
Thank you, Mr. President. I know we're all very tired. It's even a better reason for me to remind you once again of our Legislative Prayer Fellowship tomorrow morning, 7:15 in room 107. We'd love to have you join us.
The majority leader has moved that the Senate stand adjourned until 10 a.m. on Wednesday, February 27th, 2019. All those in favor of the motion signify by saying aye. Opposed, no. The ayes clearly have it. The Senate stands adjourned.